The LGBT community is a broad distinction of sexual minorities. As a community, it always tends to be open to questions and discussions, but it gets tiring having to justify the validity of your existence multiple times, especially if the person with the questions has malicious intent. I will hopefully be able to answer a lot of frequently asked questions that even those in the community might not be informed enough about. I understand that the people mentioned previously probably won't care about this video and have already disliked and moved on, but I encourage allies or those new to the community to watch, to inform themselves to aid one another in future discussion. Biological sex refers to the anatomy of an individual's reproductive system and certain secondary sex characteristics, which include things like fat distribution. In the animal kingdom, an example of a secondary sex characteristic would be color differentiation between the sexes. Gender identity refers to a person's personal identification of one's own gender based on an internal awareness and can be separate from one's biological sex. Gender expression refers to the physical manifestation of one's gender identity through speech, clothes, and behavior. These are generally dictated by social norms and gender roles. If you want to research or look for information regarding trans issues, it is important to be critical of information you find online. It is also important that you understand the context of when and where it was written, and what the information is intending to convey. If you are looking for information on trans issues, the following organizations are credible. The World Health Organization writes and is responsible for one of the two major diagnostic manuals. Theirs is called the DSM, the Diagnostic and Statistical Manual of Mental Disorders. The American Psychiatric Association is the main professional organization of psychiatrists in the United States, and the largest psychiatric organization in the world. They produce and are responsible for the content of the second major diagnostic manual, called the ICD, the International Classification of Diseases and Related Health Problems. The World Professional Association for Transgender Health is a professional organization devoted to the understanding and treatment of gender incongruence. They work with professionals from disciplines such as medicine, psychology, law, social work, psychotherapy, family studies, sociology, and sexology. The European Professional Association for Transgender Health is similar to WPATH, but consists of professionals from Europe exclusively. Gender incongruence is a medical diagnosis describing someone who experiences a marked and persistent incongruence between an individual's experienced gender and their assigned sex. There is a difference of opinion between ICD and DSM when it comes to the requirement of significant distress or impairment, which is commonly known as gender dysphoria. Dysphoria is a requirement for the DSM diagnosis, but not for the ICD diagnosis. Despite what you may have been told by right-wing pundits and those who are ill-informed, the APA and WHO do not classify gender incongruence as a mental health disorder. With the replacement of ICD-10 and DSM-4, the diagnosis F.64 transsexualism was replaced with HA-60 gender incongruence, classified under the chapter of sexual health. The new diagnosis states the following: gender incongruence of adolescence and adulthood is characterized and marked by a persistent incongruence between an individual's experienced gender and the assigned sex, as manifested by at least two of the following: a strong dislike or discomfort with one's primary or secondary sex characteristics, due to their incongruity with the experienced gender; a strong desire to be rid of some or all of one's primary and or secondary sex characteristics due to their incongruity with the experienced gender; a strong desire to have the primary and or secondary sex characteristics of the experienced gender. The individual experiences a strong desire to be treated, to live, and to be accepted as a person of the experienced gender. The only effective way to treat and alleviate gender dysphoria is through transition, but this is not necessarily something all trans people choose to go through. HA-60 does not necessarily require gender dysphoria depending on which diagnostic manual is being used, and some people without dysphoria can still choose to transition to improve their quality of life. Some people are able to fully alleviate their dysphoria through transition, but this is not always the case. The term transsexual is an outdated term used to describe someone who is medically transitioning. ICD-10 uses F.64 transsexualism, but this is currently being replaced with HA-60. This means that the concept of transsexual in the world of medicine no longer exists. The term transsexual has traditionally been used in a clinical or pornographic setting. This has resulted in lots of trans people associating the term with gatekeeping and discrimination. The diagnosis F.64 is also exclusive of non-binary identities, while the HA-60 diagnosis is inclusive. The term has a lot of bad connotations, and the term transgender is therefore more commonly used and appropriate. Transitioning varies based on the needs of the person in question. Some trans people choose not to transition. Some transition without medical intervention, and others use hormones or get surgeries. These are some of the more common treatments included in a transition. Hormone replacement therapy, commonly known as HRT, is used to alter a person's secondary sex characteristics. This often includes a hormone blocker or an anti-androgen and sex hormones, but can be done without the blocker. For example, high doses of estrogen work to stop the production of testosterone, making blockers largely redundant. However, blockers are still the preferred choice with most doctors. Reassignment surgery is a surgical procedure by which a transgender person's physical appearance and function of their sexual characteristics are altered to fit that of what is socially associated with their identified gender. Reassignment surgery is primarily performed to alleviate gender dysphoria, but it is a demanding and complicated procedure, hence why lots of trans people choose not to undergo the procedure. Reassignment surgery is expensive, but depending on the country, may be covered by health insurance or public healthcare systems. The implication that this procedure is somehow a mutilation is inherently transphobic and factually incorrect. Facial feminization surgery is a surgical intervention used to feminize the face and reduce typical masculine features. This is an expensive procedure and is considered a luxury, but certain states and health insurance companies have started including FFS under the standard transcare package. You also have smaller procedures such as hair removal through electrolysis or laser, hair transplants for people with male pattern baldness, among others. As trans rights have become more of a public discussion, the amount of propaganda and fear-mongering have also increased. One of the topics people not educated on trans issues often talk about is trans care for children and young adults. Easy access and good trans care for this group is critical, so let's clear this up once and for all. In most countries, in order for children to access trans care, they have to be evaluated by multiple professionals working with trans people. If the team that evaluated the child agree that it is appropriate to start treatment, you can access anti-androgens to halt puberty, usually around the age of 12 to 14. If a child later decides not to transition, the effects of puberty blockers can be reversed by stopping the medication. In most countries, you are allowed to start sex hormones and hormone replacement therapy at the age of 16. At the age of 18, you are allowed to access surgery such as breast augmentation and SRS. The importance of having access to early trans care and having adequate representation in media and education cannot be understated for the mental health of these normally marginalized individuals. There is extensive research about the long-term use of puberty blockers, and they have been overwhelmingly shown to be safe. The treatment isn't just used for trans youth, but has been the standard treatment for kids with precocious puberty for decades. The treatment has no long-term side effects, it just puts puberty on hold. If you stop the treatment, puberty will pick up where it left off. The American Academy of Pediatricians and the American College of Osteopathic Pediatricians released a joint statement through the Human Rights Campaign in favor of puberty blockers and gender-reaffirming care for adolescents. Like most medical treatments or drugs, anti-androgens do have side effects. Most of them are minor and are more annoying than potentially dangerous. More serious side effects do exist, but they are rare. Trans people exist and will use anti-androgens regardless of their ability to access it through insurance and public healthcare systems. So if you're worried about the possible downsides, you should focus your attention on increasing access to help trans people and not restricting their ability to use the medication within the safety and care of medical professionals. Spironolactone is one of the more common anti-androgens and is used for multiple diagnoses along with gender incongruence. It is used in patients with high blood pressure, patients with prostate cancer, women with female pattern baldness, and for patients with excessive acne problems. The drug is commonly used in most countries, and therefore there is no reason why the usage of it should be any different for trans patients compared to the general public. Detransitions do happen, but they are rare. Out of 3,398 patients seeking treatment for gender incongruence, only 16 patients expressed transition-related regret or detransitioned. Authors of this NHS-sponsored paper concluded that the detransitions observed were more likely prompted by social difficulties, not change in gender identity. The medical consensus is currently that detransition rates are between 1 and 2% after medical interventions. One of the most comprehensive studies into detransition started in 1961, and 74 follow-up studies have been published. The authors conclude that between 1961 and 1999, the regret rate for trans men was less than 1%, and for trans women between 1 and 1.5. Since 1991, the authors have also observed that a decrease in the surgery regret likely is due to an improved quality of psychological and surgical care for individuals undergoing SRS, as well as medical technology and social acceptance improvements. Even though a lot of people think certain state-level legislations in the United States or Bill C-16 in Canada is going to force you or an individual to use preferred pronouns, this is not grounded in reality. Nobody's going to get arrested, fined, or charged for misgendering a trans person, especially accidentally. But if you as a business owner or government employee actively discriminates against trans people, you can be liable. The Canadian Bar Association, representing 36,000 lawyers in Canada, said the following in regards to Bill C-16. Bill C-16 represents a long overdue step to include these protections expressly in areas of federal jurisdiction. This is not a bold move, nor should it be controversial. Although these rights are already acknowledged in Canadian law, the significance of this amendment cannot be understated. Human rights legislation is a powerful vehicle to guide understanding and education about the rights of all Canadians, to readdress harms caused by harassment and discrimination on prohibited grounds, and to advance a culture of inclusion and respect. Bill C-16 will provide tangible protections for one of Canada's most vulnerable minorities. It will contribute to a broader public awareness of gender diversity issues. It will advance equality in Canada. Trans people have an attempted suicide rate that is higher than the societal average. Studies and expert opinion suggest that the suicide rate is directly connected with family and societal support and access to treatment. Studies show that high rates of suicide attempts and its correlation with discrimination and against the trans community approach 1. Williams, 2017. The literature shows unique factors contribute to high suicide rates such as lack of social support, gender-based discrimination, transgender-based abuse and violence, gender dysphoria and body-related shame, difficulty while going sexual reassignment surgery, and being a member of another or multiple minority groups. Perez-Brummer, 2017. Medication analysis demonstrated that established psychological factors, including depression and school-based victimization, partly explain the association between gender identity and suicidal ideation. Seelman, 2016. Findings indicate relationships between denial of access to bathroom and gender-appropriate campus housing to increased risk for suicidality, even after controlling for interpersonal victimization in college. Klein-Golub, 2016. After controlling for race, age, ethnicity, sex assigned at birth, binary gender identity, income, education, and employment status, family rejection was most often associated with an increased risk of suicide. Odds increased significantly with increasing levels of family rejection. Miller-Grolman, 2015. The results suggested that gender nonconforming trans people face more discrimination and, in turn, are more likely to engage in health-harming behaviors than trans people who are gender conforming. Bauer et al., 2015. Transition vastly reduces the risk of suicide attempts, and the farther along in transition someone is, the lower the risk gets. DeVries et al., 2014. A clinical protocol of the multidisciplinary team with medical health professionals, physicians, and surgeons, including puberty suppression, followed by cross-sex hormones and gender reassignment surgery, provide trans youth with the opportunity to develop into well-functioning young adults. All showed significant improvement in their psychological health, and they had notably lower rates of internalizing psychopathology than previously reported among trans children living as their natal sex. Well-being was similar to, or better than, young adults from the general population.